Hey guys, this is Greg with Medical Muscle. Okay, so you guys have been giving a great suggestion about a video, and I needed to talk about this. Do you have to work on weekends? How much weekend work do you have to do during clinical rotations? So obviously it's program specific, different programs have different requirements on this, but I'm just gonna tell you what my experience was. So for OBGYN, I had to do two 12-hour days. Either Saturday or Sunday. And that was it. During surgery, same thing, two 12-hour days within the 12 weeks, two 12-hour days in general surgery. And then in emergency medicine, our schedule was kind of strange. We had days off in the middle of the week, and then occasionally we would have weekend shifts as possible. But I can tell you that in all cases, our program directors were very flexible with that schedule. So with OBGYN, for me, this is not for everybody, but I did both days back to back. So I did Saturday and Sunday. So what that meant was that I did a full week of 12-hour shifts. So Monday through Friday, then I did Saturday and Sunday. So that's 7 days in a row of 12 hours. But the following week, I think I had outpatient, and it was very easy. So it was nice. I just got that done, and I didn't have to do any more weekends for the rest of the rotation. For surgery, I actually never went in on the weekends. I'm going to explain how. So our director gave us an option for surgery. She said you could either do an overnight shift. So you do a 24-hour shift in one of the specialties. It was like gen surge or trauma, or you do the weekend shift. And for me, I preferred just doing the 24. So on Friday night, after I was done with the whole week, I just stayed there the whole day. And I'm gonna say that that was probably one of the best experiences. And other students that I talked with said that if you're gonna do surgery, do an overnight, because this is the benefit of doing these overnights. You're the only medical student. Everybody else is gone. I was the only one. So I got to go to all the crazy cases. I actually got to participate a lot more. So if you're interested in surgery, I would say definitely take advantage of these overnight trauma events, because you just get to see things that you normally don't get to see, okay? And you're the only one. You're the only student in the hospital. The downside is it's a long shift. We didn't have a place to sleep, a designated place to sleep. So if there was downtime, you just had to find a little corner where you can take a quick nap, but not a specific bed or anything. That was the only downside. That's why it wasn't required for us to do overnights, because we didn't have a specific room. But I thought it was a great experience. For emergency medicine, our program director was very flexible. I actually didn't want to do weekends. So what I would do is I would switch a day from a weekend to midweek. So I'd work all through the week and then take the weekend off. That was an option that we had. Not everybody's gonna have that, but that's what I had. I've heard from other students in other hospitals, they had to do overnight 12 hours in OBGYN. They had also 24-hour shifts in surgery. That was standard. Ours wasn't, because of not having access to a bed, like a call room. But it depends on which hospital you're in. But that's how many we had. We only had 2 required for OB, 2 required for surgery, and then the occasional one that was in emergency medicine. That wasn't that crazy, because you got a mid-week day off, so not a big deal. All right, now, yes, you don't have to go in the hospital that much for a lot of these rotations. Actually, the only other reason you'd have to go on the weekend is if you missed a day. Like if you were sick, say on one of the weekdays, you would usually use the weekend to make that up. Okay, that's the way it goes. Okay, so outside of that though, yes, you're not necessarily going to the hospital, but you still have some kind of study work that you have to do. I pretty much never took the weekend off. I always did some kind of work. So usually on Sundays, I was doing the firecracker quiz that's required. You got to do one every week for almost all the specialties. I would work on my write-ups, patient write-ups, if I had one due that week, so something that you're going to present to your group. And I would be knocking out, UWorld questions every single week, every single weekend, maybe some Anki cards, something like that. I didn't do a lot of work on the weekends. I tried to do the bulk of it in the middle of the week, just like I did through term 1 through 5, because I wanted some time off during the weekend. So I wasn't working that crazy. It was only maybe max, I think, 3 hours max on the weekends, on Saturday and Sunday, 3 each. So 6 hours total. But I would say on average, it was probably more like 2 hours. So 4 hours total on the weekends. Not that crazy. But here's the caveat. As I got closer to the shelf exam, so say if it's a 6-week rotation, by week 4, I would start doing the NBMEs, and I'd usually do them on the weekends. Most students did them on a Sunday. That's what most of us did. And those are 2 hours and 45 minutes maximum time that it could take you. But I took the whole time. So that's 2 hours and 45 minutes of a Sunday to do the exam. And then you have to review it. And that takes, if you're gonna do it within that day, that's gonna easily take you an hour, maybe an hour and a half, maybe longer, okay? So I would try to get through some of it on Sunday and then review the rest of it throughout the week. So that's a busy weekend. You have this combination of work shifts and then studying and then the NBMEs. And I think you can potentially have access to up to 6, maybe 8 NBMEs, I think, maybe. So that's a lot. Now, if you absolutely don't want to do any studying on the weekend, that is possible. That is very possible. I just think it would be very challenging, because what that would mean is that you have to get a lot of work done in the middle of the week, which you do have some downtime within each rotation. There are times when there's no patients. That would be the perfect time to get your studying in, okay? Maybe not to knock out an NBME. Maybe you could, if you were really diligent with your time management, you could do an NBME at the end of the night after, say, an easy outpatient shift where you're only there till say 2 o'clock. You get home, do an NBME. Perfect time to do that, okay? But I wasn't that organized. I like to goof off maybe a little too much. So that's kind of the weekend requirements. But you're doing it for a good reason, right? You want to become a successful doctor. You're going to put in that effort. The people that I know who did very well in their step scores, they worked quite a bit, okay? You have to balance, recovery on the weekends. You have to take care of yourself. You can't just keep pushing yourself till you hit a wall. But you do have to be consistent with doing questions, and it just continues throughout the week, okay? All right, guys, I wish you the best of luck on whatever exam you are on.